Move, people! We're not losing another erection today!
Homer's erectile emergency, ultimate grease wars, and whatever you do, don't pull it out. Get ready to laugh because today we are breaking down and reacting to all of the ridiculous medical scenes and mind-numbing injuries from The Simpsons. All right, let's dive right in.
Just try a sip. What do you think?
Foggy and under season.
Isolated tongue swelling. As an ER doctor, that is a big red flag for us. That's something called angioedema because it can be isolated to the tongue, the throat, and then you have airway compromise.
I'm sorry. I hate this. I have no similarities with any of my offspring.
My tongue is swelling too.
Hey, look at
Oh.
us. Our throats are closing as one.
There are some people that get a hereditary angioedema, and there is a medication that we can use to help reverse that effect on the body. Angioedema may not be an allergic reaction. It could be a reaction, but not mediated by our allergic marker, so to speak.
It turns out you two have many common allergies, including allspice, dust, feathers, fur, the stuff in peanut butter that isn't peanuts.
For people who have allergic reactions to something, most common that we see are like peanuts or nut allergies that somebody accidentally ingests a nut and then they show up swelling, hives, not feeling well.
Oh,
What's wrong, Dad?
you're such a great kid. Sorry I passed down all those bad parts.
The only time you'd end up at the allergist and not the emergency department is if you actually had an appointment. The allergists, immunologists, they see people in a clinic or their office and you got to make an appointment. You don't roll up to their office in an ambulance. You show up to the hospital.
Abraham Simpson? Cornelius Talmadge?
Oh, no, I'm not. Oh, well, let's see what you got here.
Bad idea.
Hey, they got chairs with wheels. And here I am using my legs like a sucker.
No, please use your legs. Please use your body. If you don't use your mechanisms of function, you're going to lose it. The muscles will degrade. They will become weak and actually start pretty much like melting away. So please make sure that you're actually continuing to walk, exercise, put them through the ringer because you want them to function at their best for you.
Who knew that Lay's made liquid potato chips? I can't suck just one.
Oh my gosh, that's awful. So typically when you see a bag of fluids like that, that's not clear. So you have fluids and medicines that are typically clear. They go into your IV. But then there are people that say they can't eat or chew food. You can actually put a tube into somebody's stomach and then you can actually put this type of processed, more balanced liquid that goes into the stomach to feed somebody. You don't drink it like Homer's doing.
Please. Also, I think I'm getting a bed sore. What do you have to do to get turned around here?
Bed sores are typically what ends up happening when you're laying on one spot for a long period of time. You actually have tissue breakdown. It can lead to ulcers, open wounds, increase the risk of bad infections, and the infection can get into your bone called osteomyelitis. Again, you do not want that. You need to rotate the position of individuals, so you need to shift and move them frequently if you're not doing it themselves.
Homie. Hey, homie. Seems like nothing's really happening down there.
I didn't even know it couldn't do that. Well, no need to panic.
What? Oh my gosh, look, the erectile dysfunction rapid response unit. Oh my gosh. When is it a true emergency? Typically related to an erection that lasts more than 4 hours, trauma to that area, significant pain. You always worry about like twisting of the testicles. That's a true emergency.
Move, people! We're not losing another erection today!
Feels like it does happen in real life, but not from it being down, but from it being up. The longer you have an erection, the longer the blood is sitting in your penis, greater the chance it has to fibrose, thus leading to permanent erectile dysfunction, which we don't want.
We have a mighty arsenal of treatment options at our disposal. Now, Homer, these ED meds will adversely affect your mood, causing aggression, irresponsibility, and a tendency for your mouth to write checks your ass can't cash.
They're talking about hormonal changes versus the medications that they're using for erectile dysfunction don't necessarily have to do with hormonal changes, it has to do with more blood flow to your nether regions. There are other components relating to different levels of testosterone that might be in your body, hence the hormonal changes that may need to be evaluated, but it needs to be checked versus just giving somebody medications.
It's a great idea, Simpson. Free silver dollars, compliments of C. Montgomery Burns.
Silver dollars are pretty heavy and pretty big. It'd probably be a lot harder to throw those.
Oh! Oh, take it out! Take it out!
And I wouldn't take it out. Just leave it there. As I always say, please don't pull it out. You don't know if you've now going to expose brain tissue to the world. Get to the hospital, let a doctor pull it out. We can even get images before we pull it out and make sure that things are not injured underneath. Yep, there it is. Literally. Now you have a bleeding spout, you hit an artery, now you have to deal with this type of medical issue versus if you did pull it out, it was tamponaded, it was blocked, and so you weren't having a massive amount of bleeding.
Wanna go bowling?
Maybe you should see a doctor about that cord in your brain.
Maybe you should mind your own business. Afternoon, miss.
Wow. And it's dirty, so now we increase the risk of an infection. Infection around the brain is not good. We all know that. Probably get a CT scan of the head. We can see decent amounts of what's going on.
Not so fast, boyo. Well, if it was up to me, I'd let you go. But the lads have a temper, and they've been drinking all day.
Oh my goodness, wow. Getting punched in the face. Very common injuries. People come into the emergency department with fractured jaws, bruised faces, fractured maxilla. The most common fracture I end up seeing with somebody who comes in with facial trauma due to getting punched is usually an infraorbital wall fracture. We end up seeing a crack through there, blood in the maxillary sinus, and if you sneeze, you're going to get air into your tissue.
I'll strangle you for a while. Good.
And then you have strangulation. We actually see this enough in the emergency department that we do CT scans of the blood vessels of your neck, because when somebody gets strangled, not only are you concerned about swelling of the airway, fracture of your hyoid bone, you worry about the blood vessels. The amount of force on those areas can cause shearing effect and actually cause a ripping of maybe some of the layers within the blood vessels. What? So I think it's like a Evel Knievel throwback, but putting yourself in a safe so you can't open and see. Well, let's see what's gonna happen.
Okay, he's cleared the ring of fire, past the ring of ice, over the dog do stick. He's cracked the safe.
Hey, Flanders, don't spill my beer!
Oh, God, lay down.
Flying through the air on a motorcycle, probably not the safest thing in the world to do. And of course, having somebody who's not compliant with what you're trying to do can even happen in the hospital, where we have patients who we're trying to do different procedures on that might not be compliant. It does happen. So not everything goes as planned like this.
Lay down.
Clear!
What?
He's all right, folks.
Yeah, sure. Traumatic brain injury, multiple fractures throughout the body, could be cardiac arrest due to the injury to his brain versus trauma to his chest. They immediately go over, they don't assess, they see an unresponsive patient. You check for responsiveness, check for a pulse, see if they're breathing. Those are the basic things. If you do not see that, start CPR. You could start CPR or immediately put the AED on and allow it to check the rhythm that's happening. Just shocking somebody for the sake of shocking may not help. They need to be in a shockable rhythm. The Simpsons, as always, continues to show a lot of medical stuff and actually pretty straightforward things that do come to the emergency department often. And if you guys enjoyed this, definitely check out this playlist right here. Binge watch everything. And do me a favor, please subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.